locator system and the magnetic system.
Good morning, ladies and gentlemen. My name is Yoshihiro Kotsuro. It's my pleasure to be here. In our study, we created implant retained complete dentures. The subject were dangerous patients in their 50s and 60s. We used the rotator system and magnet system as retainers, and we examined the characteristics of each system. Implants have been effective retainers, which increase the stability of dentures and mastication efficiency. They have also improved the quality of life of patients. There are a number of retainers. However, the locator system and magnet system provide relatively high stability compared to others. I would like to present a summary and the use of these systems in a few cases in our study and examine each system. This is my CV, education and activities. We have a website in 3 languages. The website includes some interesting case studies. If you wish to explore more interesting clinical cases, you may visit our website. There are much more cases shown in Japanese and English and Chinese. Japan is becoming an aging society. The ratio of people over 65 years old will reach 20% in a few years. By 2050, the ratio is projected to reach 32%. In China and Korea, the birth rate is declining even faster than in Japan. So, in the future, our main clients will be senior citizens. Their jaws are not strong enough for standard dentures. Therefore, the best treatment for them must be implant supported denture. Japan, China, and Korea are all becoming societies of older people. We created implant retained complete dentures. The subject were dangerous patients in their 50s and 60s. I would like to present the summary and my use of magnetic attachment in a few cases from our study. There are the types of retainers. However, the locator system and magnet system are 2 of the most stable systems. Are used for implants set polygonally for better stability. I will be thinking about implant supported dentures using magnet system. Let's compare the locator and magnet system. Here is the initial examination. This is the patient's condition and panoramic radiograph at the first consultation. There is little bone resorption in the mandibular anterior region, so implant placement for the magnet system is possible. the final denture placement, denture stability was achieved. These clients got a denture that is not only aesthetic but also function. This is the video of setting the denture. It is easy to set the denture for magnet system because there is no restriction of the injection in magnet system. For rotator system, we must pay more attention to set the denture due to the direction of taps. We measure the detention resistance force against the denture separation with a tension gauge. Even 1,000 grams of separation force will not remove a denture inserted into the implant. We need to some caution when applying magnets. There are several magnet types. The most effective one is a flat magnet. Magnetic attachment, which made in Japan, gives you influence for the position of artificial teeth and size of denture base because it is thin and small. I will explain why using the model. In the case of rotator, we put metal on the abutment and finger to push and guide the denture to be set. In the case of magnet, it is easy to set in denture because of magnetic absorption. We just put the denture near the implant body and then finish wearing it. When setting denture, locator will give the implant body a big lock, but the magnet almost will do not. Reposition. If the denture has a little dislocation, it is difficult for it to return to the original position. In the case of rotation, however, it is easy in the situation of magnet. In the case of rotator, it is difficult to fix original position and the lost stability of denture if the denture is out of that place. In the case of magnet, if the denture has a little dislocation, it will naturally go back to the original position and can exert the maintenance power again. Lateral force. If the denture receives a lateral pressure, it will take a big direct force to implant body in the case of rotator. However, it almost doesn't in the situation of magnet. Magnet can be minimizing the lateral pressure to the implant body. take off the tension. When you remove the locator, it gives more load than when you attach it because it needs more stability to the implant body directly. In the case of magnet, even if the denture has a little flow, it also can be taken off smoothly. This movie of denture setting in the locator, in the case of locator, it is important to push the denture using the fingers. Magnet can be attached easily by putting the denture to near implant body. This is a movie of taking off denture. In the case of locator, patients mostly need both hands because need to power with putting patient finger between the denture and the gum to remove the locator. But in the situation of magnet, we just take a denture a little turn and then smoothly let it off, even if one hand can do. Magnet system must be little stress of attaching and removing the locator system for the patients who have some handicap of finger or hand. Both the locator system and magnet system are easy to clean, but the magnet system is the easiest. Sustaining power of the magnet is permanent. Basically, there is no necessity to change it. Finally, I will show you the clinical case. This patient is a female, 51-year-old. She has serious periodontal disease and the gum is obviously swollen. We cannot keep the remaining teeth. It is important to assure that teeth alignment is harmonized with the lips. Stable occlusion, dental aesthetics, and comfort are achieved. We remove the remaining teeth and created a denture with magnets. By using implants, we could create a prosthesis with satisfying functionality and enough strength to maintain its position. There are 4 implants, each in the mandible and the maxillary. Conclusion. I am convinced that dentures with implant will be a very effective recovery treatment for the coming aging society. Dentures supported by implants are very stable and provide a high efficiency of mastication. There are various retainers, but the magnet system is especially reliable. Due to their unmistakable advantages and high compatibility from the above, I recommend strongly the magnet attachment. Thank you.